I'm looking forward to talking through exactly as Walter described how the Ottawa Method Center in particular might be alongside my colleagues from Craner, another resource that you might be currently drawing from or could draw from more in the future in supporting your work. And what I want to make the case for is really that Ottawa and the Ottawa Method Center in particular really provides expertise for each gear in the learning in the learning health system, and can operate, and we operate very much as a hub for that type of expertise, not only within gears but across these gears. And I'll give you a couple of specific examples of how we try to connect make those connections. So the Ottawa Method Center really, I hope if you don't know about us, that you see it very much as an infrastructure that you can draw from. It was established in 2006, but now includes over 30 methodological specialists that span 9 different specialty areas, which I'll talk about in a couple of minutes. And the types of clients that we serve within the Method Center include the scientists and clinicians, trainees, students, and researchers, but also government and healthcare organizations more generally as well. And so we like to see ourselves as very much a methodological one-stop shop for engaging in multiple processes across the learning health system. Okay, so in terms of what we do, and I mentioned we have sort of 9 areas of specialty focus. So on the left-hand side, it's sort of cross LHS perspectives in really design, methodology, data management, backend, and outputs and publication. But then the center column and the column on the right is really the core of the gears. So we have expertise in knowledge synthesis, in big data analytics. So when we're talking about data linkage, ICS data, or down to more specific biostatistics expertise, have health economics expertise, patient-oriented research, as well as knowledge translation and implementation science, which I'll talk about in a bit more detail. So as I mentioned, we very much see the expertise that we can provide and in partnership with yourselves as fitting into all the gears of the learning health system. And I wanted to walk you through a couple of examples before deep diving a bit more into what we're here today, more specifically on around the evidence synthesis and support. So one of the resources, which I'll just spend one slide on, is in the central gear of the whole LHS around patient, family, caregiver, and provider co-design, is we've established what's called the Office for Patient Engagement in Research Activity, or OPRA, website being there, where we have resource staff within this office that really focuses on how patients and caregivers and provider and family members can partner in the whole process, whether it's to support identifying potential patients or people with lived experience, engage them in the study or evaluation design and thinking about training for them, help them to be a part of the process of developing research questions and broader engagement research methods. So if this is an area that might be of use within your OHT, feel free to directly reach out to our OPRA folks within the Method Center. The second gear that I wanted to emphasize is around implementation, which isn't going to be the focus of today's webinar necessarily, but wanted to emphasize that within the Ottawa Method Center and Ottawa in particular, we have a dedicated center for implementation research that assembles 14 multidisciplinary, interdisciplinary experts in implementation science. It was established in 2018, in fact, January 20th, 2018. And you might ask yourself, why do I know that so specifically? Is that on the launch date of our center happened to be the date that my daughter was born. And so that one etched in my mind forever. But what our Implementation Research Center provides expertise in is very specific areas of implementation science, and whether it's leveraging data for feedback to teams or providers, developing rigorous decision aids, evaluating clinical practice guidelines, as well as the methods such as evidence syntheses, qualitative survey, consensus methods, in intervention evaluation, barriers assessment, and intervention co-development. And so it's really a deep dive for the implementation cog. And so if you're interested, I haven't been able to follow the chat because I've been speaking so quickly. Apologies if it's been a bit too quick of a, a whistle stop tour. But if you're interested in leveraging any of the expertise within the Method Center that we've talked about, you can put in a service request directly on the website, ohri.ca/Ottawa Method Center. And so that will trigger a triage, and we go through all requests, reach back out to everyone. You're set up with a free consultation to see how we can address your needs, and then work with you to see how best we can support you. If you have a really quick, short question that doesn't need a consult, you can also even ask a question directly on the Method Center website. So do use that resource if you think that can be helpful. But of course, also reach out to me directly if I can be helpful. And I'll leave it at that if anybody has any questions.